This video focuses on key areas. So key areas means that you need to go back, have a look at your last assessment and rating, look at the areas where you had working towards and see where you can do improvements in the things that you may have been doing to lift that up to meeting. It's also important to be aware of other services and where they were working towards within their self-assessments.
You obviously know for your service what it was that you were rated as working towards as opposed to meeting on, but it's interesting to know that it's similar trends across the state. The areas that services are having the most problems with include, of course, educational program and practice. Now that could be because it's harder for family daycare services to meet an area that in a lot of ways the National Quality Standard is geared towards services with early childhood teachers in them. But there are two particular elements within that area that services are failing at, and that is critical reflection, and the other one is the whole assessment and planning cycle. So when you're preparing for your reassessment, look at those two areas in particular.
So quality area 1 for us is always difficult, mainly because of the high percentage of non-English as first language educators that we have in the service. So we work with all of those educators one-on-one to find the best tool for them to document. That whole planning cycle is really difficult to understand, and we go really well until we get up to that critical reflection part, and it's a difficult concept to understand, even sometimes for staff. We work with educators to find out what works for them best. We ourselves have developed a programming book. We've worked really hard to have a programming template that really addresses all of the elements of quality area 1 and really has tried to raise the bar of our documentation cycle.
Another area that services that are rated as working towards overall are struggling with is health and safety. And as we know, that's an area that it's heavily a compliance area. You either are doing this or you aren't doing it, and it's so easy for an assessor to walk in and see the one time that your educator isn't doing something in the health and safety area. But it's also an area where there's been some changes. One of the elements that services aren't meeting is emergency management and planning. And we suspect that this is something that more services will meet now, because the department has kind of clarified that maybe the assessors were looking at that in a way that was a bit more centre-based focused before. The other two elements that services were having problems with that were rated as working towards was health practices and procedures. That's your administration of medicine, your managing of people with definite medical conditions, and also supervision. Supervision's always hard in family daycare, and it's often hard for an assessor to understand how supervision works in the family daycare service environment.
So children's health and safety is something that we all take very seriously. But we've found that by using the tools that are supplied by both the department and ASEQA as the basis for what we do, then it's fairly easy to be able to meet the compliance and quality components of quality area 2. We also found that having one person responsible for keeping that data in terms of it coming into us at the coordination unit really helps as well, so that we're not chasing after pieces of paper in terms of incident reports or first aid qualifications being up to date. If it all comes to one spot, it's a lot easier to handle, even with a bigger service.
The final quality area that services are having problems meeting is physical environment. And the two elements within that is upkeep, which is sometimes often beyond what a service can really control. So you need to talk about those elements that you have in place, like daily safety checks, and about the environments that educators are creating for services, and about the use of the wider environment as well as the actual home, to assure that the assessor that you are in fact meeting that particular element. The final one is environmental responsibility, and that's always a hard one. In the revised NQS, it's that services both are environmentally responsible, but also that they help children to learn how to be responsible for their environment. If the assessor doesn't see the educator doing anything towards environmental sustainability or teaching the children about the environment, is it something that you can point out?
For Quality Area 3 and environments, it's something that we're very, very passionate about. So we try to get that to reflect our philosophy. Our philosophy is to reduce the use of plastic, have lots of open-ended, loose parts for children to play with. And we demonstrate that not only in our playgroups at our hubs, but also when we go out on visits. So we're always talking to educators about what they can change and what they can do in their environments. Sometimes we even go in and help an educator completely revamp their environment. So throw it all out and start again with a clean slate and build it back up again. It's just working and recognising that an educator, although they're part of a very big service, they're also an individual. And so we need to work with them individually to get them to be able to meet all of those quality areas to the best of their ability and within the bounds of their actual residents as well.
Reflect on, I guess, what your report was. You know, there's probably little things in that report that you are doing, but they didn't go to that educator that offers that service, or they didn't see it within your service because they weren't there long enough. It's just about picking yourself up, reassessing it, reevaluating, and moving forward with that.
So the tip that I would give is to laboriously, systematically go through the NQS, the National Quality Standards, and flesh out how your service meets each of those elements.
Another strategy that we have used is working out what all the ratings actually mean to us. How are we meeting up to our own standards?
We find that resource, What to See, Say and Show, to be invaluable, because what it does is it breaks down in a more visual way what it is the assessor's looking for, particularly when it is what to say and what to show on the day. So educators really respond well to what's in there because it breaks it down for them.
I think one of the things that we have to remember during assessment and rating is that assessors don't do as many assessments of family daycare services as they do centre-based care. So often the default in their mind becomes centre-based care. We know what we do in family daycare meets and exceeds centre-based care in many areas, but you have to spell that out for the assessors. It's as hard a job to be an assessor as it is to be an educator or a nominated supervisor or a service manager in many ways. And we have to help make their job easier. We have to make it clear for the assessors as to how they can find the evidence that they need to tick that we're meeting each element of the National Quality Standard.
So I think it's really important as a community, a family daycare community across Australia, that we really do try and move forward from working towards and, you know, really come up to that meeting and exceeding level. I think exceeding services are services that are more than willing to go out and, you know, help and role model and show services how it can be done. Family daycare is amazing. It's something that my children have all gone through. It's something that I'm extremely passionate about and I sell. And I think if we can move forward from working towards for all schemes and have them at meeting and exceeding ratings, it really will show the public that our services are amazing. They are fantastic and they are one of the best services for children to be in their early years.